This video is going to cover the neurologic examination. Way back when I was creating this app, the whole purpose was just to create a neuro localization app. However, you can see that it's definitely evolved from there because the more I developed the app, the more people would give suggestions on things that they would also like to see in an app. So that's why it's evolved into what it is today. But the neurologic exam was the main purpose of creating this app. When you click on the neurologic examination, you can put in more of the history if you want. That will be exported with the rest of the neurologic examination, but you don't have to put in anything up here. You'll see that there's a lot of different sections for the neurologic examination. If you open the menu for spontaneous movements, you'll see some of the common things like seizures, tremors, jerks, things like that. But maybe there's some that you're not familiar with, like paroxysmal events. And there's a lot of paroxysmal dyskinesias, different types. There's kinesiogenic dyskinesias, non-kinesiogenic dyskinesias. There's the Cavalier episodic falling syndrome. So a lot of different paroxysmal dyskinesias that are out there. If you're not familiar with what they are, you can select clinical comments. It'll give you a brief overview of paroxysmal events, and maybe you want to know more about the Cavalier episodic falling syndrome. That information will be provided down here. Or if you're wanting information about kinesiogenic dyskinesias, that's going to be provided as well. So that's the whole point of the clinical comments. Maybe you want more information about seizures, idiopathic epilepsy, that information will be provided if you have the clinical comments selected. Same thing with phantom scratching. So every portion is going to have a clinical comment, even if sometimes it's very brief. I'm going to turn that off just for the sake of simplicity at the moment. When you select seizures, you'll see that there's different options as far as focal generalized or focal to become generalized. We can select the generalized section, and then from there there's different options as well. Is it tonic-clonic? Is it just clonic? You don't have to fill out all these sub-menus, but if you want to be more thorough, more detailed, then absolutely you can select those. So we have that information selected. Then we can select the behavior, and depending on what type of abnormality we're seeing, we can put in that information. For the sake of this, we'll say maybe the patient is circling to the right. Again, if you need to know more information about what some of these are, then you can select the clinical comments and see more information on that. I'll turn that off again. I'll close that menu. We'll go to mentation. For this patient, we'll say that they're a little bit lethargic, and we'll leave it at that for now. Maybe there is an abnormal posture. For the sake of this, we'll say a head turn to the right. And if we want to know the difference maybe between a head turn versus something like pleuristotnus, you could select pleuristotnus and see the difference between the two. But for now, we'll leave it at just a head turn to the right. And I'll close our clinical comments for now because you can see there's quite a bit of information that is displayed for those that need those clinical comments. So collapse mentation, here we have gait. The first thing that you should be putting in is if they're ambulatory or not. For this patient, they are. And then from there, you can put in if there's any abnormalities that you see. So this is alphabetical. Hopefully you can appreciate that. And maybe this patient on the left side has a little bit of proprioceptive ataxia on the left and the right pelvic limb. The left thoracic and left pelvic limb. And then we'll collapse that section. For the cranial nerves, we can open up that, and it's going to have its own submenu just because there's a lot of information to put there. So maybe for this patient, the left eye was enucleated, and we're not going to be able to see any information about the left eye, so it's only going to be the right eye. So all that information, anything that involves the eye is going to remove the left eye. Maybe we do on the left side, however, have decreased sensation to the face, decreased nasocortical response, and maybe the rest of the exam was okay. So I'll collapse that section. For proprioception, there's going to be a number of different proprioceptive tests that are available. You don't have to do all of them by any means. Usually we're just going to do paw placement and hopping and consider that pretty complete for most patients. So for the sake of this, we'll just say that there's decreased paw placement in the left thoracic and left pelvic limbs. Spinal cord reflexes, again, you can be very thorough with those. Most people aren't going to do all of them, so that's why not evaluated is selected. And we'll just say the withdrawal and the patellar reflexes are going to be normal in this patient. So we'll collapse those sections. Next section that we'll see is muscle mass. And we'll just say that there's maybe mild generalized atrophy. Nothing too severe. The muscle mass within the limbs, there's nothing overtly abnormal with any of the limbs, so we'll leave that unselected, and then we'll say our muscle tone is normal in all the limbs as well. The perineal reflex we'll say is normal, our anal tone, our tail tone, we'll leave all that as normal. Same thing for continence. And then for nociception, we're going to leave that as not evaluated because the patient is ambulatory. So it's going to be nociception. And then for cutaneous trunci, we'll leave it for the sake of this as normal. If there was an abnormal cutoff, then you could select where that cutoff is at on each side. But again, we'll leave it normal for now, or if it's completely absent. And then, are there abnormal sensations? So does the patient have hyperpathia, hyperalgesia? If they do have hyperalgesia, then you can say where. So maybe this patient, it's on pain on cervical palpation. And again, if you're not sure, hyperalgesia versus hyperpathia, then there's going to be information in the clinical comments section on those portions of the exam. So once all that information is in, you can then calculate results, and you can see the abnormalities are going to be highlighted in bold. And then as we scroll down to the very bottom, we'll see that there's going to be a neurolocalization that's provided. And in this patient that was circling to the right and had left-sided deficits, we can see that left forebrain was the major localization with pretty good confidence overall compared to the other two. And if you want to know more information about right forebrain localization, you can select on View Details, and it's going to give you differentials depending on how long the clinical signs have been occurring and the progression of those clinical signs. And this is by no means a complete list, but this is going to be some of the more common conditions that would cause a localization to that region, and then different recommendations depending on what we think the most likely differential is. So that's going to be the neurologic examination portion. The more thorough you are with your examination, the more likely it is to give you a correct neurolocalization. Other parts for neurologic assessment, there's going to be the Glasgow Coma Scale, which is going to include the 3 sections most of us are going to be familiar with. So as you put in the information on each of those 3 sections, you can calculate the results, and it's going to give you a total score at the top, and it'll tell you if the prognosis is good, poor, guarded, and there's also going to be information on how to manage that patient depending on what the score is. And there's a little chart on how to handle some of these patients depending on what their modified Glasgow Coma score is as well. Again, this is a general guideline taken from different texts and different literature. For each patient, this could be variable, so definitely please keep that in mind. For the neurodisability score, this one's pretty straightforward as well. It's just going through the different portions of the neurologic exam, filling out the score, and it's going to give you a result on if the patient is severely neurologically disabled, moderately, mildly, and this could be a way to monitor progression of disease like meningoencephalitis in some patients. And then finally is our Texas Spinal Cord Injury Score. This is just a more thorough way of giving a grade to a patient that has a myelopathy. So this doesn't need to be done on every patient, but if you're monitoring a patient over time and how they're progressing, maybe they're a patient with a T3L3 myelopathy, you're worried has a disc disease, and you want to make sure that they're going in a positive way versus a negative way, this would be a more thorough way to try to evaluate that. So that's going to be it for the neurologic portion of this. All of these, just like the rest of the portions of the examinations, can be exported. They can be exported as an EasyVet format, a PDF, or a Word document. Something that I really haven't mentioned at the very bottom is this patient folder. If you want to create a folder for a patient, the app will automatically do that, and you can keep adding different either PDFs, EasyVets to that patient folder. So that way it might be easier to find when you have a lot of patients, depending on how you use the app. That's going to be it for this section.